In the 1800s, there was a diagnosis called drapetomania, a supposed mental illness that caused enslaved people to want to flee captivity. The cure was more brutal control. The desire for freedom was literally classified as a disease. Women who were too opinionated, too sexual, too emotional, too anything, were diagnosed with hysteria, a catch-all that could justify anything from forced bed rest to institutionalization to surgical removal of reproductive organs. Gay and lesbian people were classified as mentally ill until 1973. Being transgender was classified as a disorder until relatively recently, and the language around it is still evolving. And teenage girls who wanted to be their own people, rebellious, pathological, in need of correction. The pattern is always the same. A person asserts their humanity, and a system that depends on their compliance calls it a disease. That should make us deeply uncomfortable, not just historically, but right now. Because if this pattern has repeated itself across centuries and across cultures, we should be asking, what are we doing today? Where are we doing it today? Who are we pathologizing right now that the future generations will look back on with the same horror that I feel looking at this 1953 book? I don't have all the answers to that question, but I think asking it is a moral obligation, especially for those of us in healthcare, especially for those of us who have the power to label and diagnose and treat. We carry an enormous responsibility to make sure our clinical tools are being used in service of the patient, not in service of the culture's comfort. We don't force compliance anymore. We build resilience. That's not just a tagline. That's a philosophical commitment. That's a line in the sand. That's a promise that the healthcare of today and tomorrow will be different from the healthcare of 1953. Not because we're smarter, but because we've chosen to center the patient instead of the power structure. And every time we default to control instead of collaboration, to shame instead of support, to compliance instead of empowerment, we need people who will call it out, who will point to that 1953 book and say, remember, we promised we wouldn't do this anymore. Before I close out, let me bring the disclaimers back around one more time because this stuff matters. Everything I discussed today is for educational and informational purposes. I shared historical context, modern research, and my perspective as a nursing professional. This is not a substitute for professional mental health care. If you or your family is navigating adolescent behavioral changes, family conflict, or mental health concerns, please reach out to a licensed therapist, counselor, or healthcare provider who can work with your specific situation. Resources can include 988 for the Suicide and Crisis Lifeline, and you can call or text 988 anytime 24/7. Or text HOME, HOME, to 741-741 for the crisis text line. SAMHSA National Helpline, I have a problem pronouncing it, 1-800-662-4357. They give free referrals 24/7. And don't forget battletestednursing.com for our future nurses. Join our community. Get some evidence-based health resources and information that will follow you throughout your nursing school career. You are not alone. Help is available. Asking for it is not a weakness. It's one of the strongest things a person can do.